Hello, you alright? Checking responsiveness. No responsiveness. Breathing. Can I get a beat?
We'll get spurts and we'll get runs. We'll have a week. We'll have 2, 3, or 4 in a week, and then we won't have some for a month.
Gonna check some pupils here.
And it's tough now because I think a lot of times when people are overdosing, their friends or family is giving them Narcan and not calling 911. So we might not even know about a lot of these because Narcan is so well distributed and well around, which is good. I'm glad the Narcan's out there, but as you can tell, there's lots of other things that we do for the patient other than just give them Narcan, like breathe for them, why the Narcan takes time to kick in.
Pupils are pinpoint. Possible opioid overdose. Gonna breathe.
Narcan.
Grab some Narcan. Go ahead and check some vital signs.
Any kind of pain medicine that's an opioid, what it does is if it's taken, if too much of it's taken, it's a respiratory depression, so it'll slow your respiratory rate, and if you take too much of it, it'll slow it so much that you stop breathing. So then that's what causes the cardiac problem. And if we don't get to the person in time to breathe for them, or don't get them Narcan or both on board as quickly as possible, then respiratory arrest leads to cardiac arrest, and then they're a full cardiac arrest where you chest compressions and the whole 9 yards. So that's why calling early is really important to make sure that we get there as quick as we can before it gets to the cardiac arrest.
1 1,000, 2 1,000, 3 1,000.
Go ahead.
Ready to go?
Here's some Narcan. Plug a nostril. Narcan administered. Narcan administered at 13:09.
You want to make sure the general public knows to call right away, push the Narcan if you have Narcan available, and we will take care of the rest when we get there. So
He just opened his eyes, started to open his eyes a little bit. Listen to some lung sounds, make sure we're getting good lung sounds on him.
they should always go to the hospital because we don't know for sure if the amount of opioid or the amount of narcotic in their system is more than the amount of opioid that we gave them. So we don't know if they'll if the Narcan or naloxone will wear off before the drug wears off. So they should always go to the hospital and be seen and make sure nothing else happened and make sure that they should be under observation. Respiratory rates increased, breathing on their own.
Sounds are clear and equal.
Are you awake? Are you waking up for us? Pupils are now reactive and normal.
And they wake up from there. Good job, guys. Community Health on Centennial has a program where you can go to and it'll help you get yourself off of these opioids if that's what you're addicted to. So that's hopefully that's an important takeaway point, you know what I mean, to actually help fix the problem or help with the actual problem instead of just giving Narcan to stop the overdose, help stopping them from from getting away from that and rehabilitation begin.